and the second most common cause of cancer death in the UK. 1 in 15 UK males and 1 in 18 UK females will be diagnosed with bowel cancer in their lifetime. In the UK, 54% of bowel cancer cases are preventable. Welcome back, viewers. Today's topic is on colorectal cancer and the 7th part of the cancer series. More than 1.9 million new colorectal cancer cases and 935,000 deaths were estimated to occur in 2020, representing about 1 in 10 cancer cases and deaths. Colorectal cancer ranks third in terms of incidence, but second in terms of mortality. Incidence rates are approximately fourfold higher in transitioned countries compared with transitioning countries, but there is less variation in the mortality rates because of high fatality in transitioning countries. There is an approximately 9-fold variation in colon cancer incidence rates by world regions, with the highest rates in European region, Australia, New Zealand and Northern America, with Hungary and Norway ranking first in men and women respectively. Rectal cancer incidence rates have a similar regional distribution, although rates in Eastern Asia ranks among the highest. Rates of both colon and rectal cancer incidence tend to be low in most regions of Africa and in South and Central Asia. What is cancer? I have filmed a video to explain this in detail. I recommend you to watch that. The link is in the description. The colon and rectum are part of the digestive system. The other names are large bowel or large intestine. The cancer starts in the lining of colon or rectum. The colon is almost 5 feet long and divided into 4 sections. Ascending colon runs up the right side of the abdomen. It is connected to the small intestine by a section of bowel called the cecum. Transverse colon runs across the body from right to left under the stomach. Then descending colon runs down the left side of the abdomen. Then there is sigmoid colon, an S-shaped bend that joins the descending colon to the back passage. Whereas rectum is the last part of the large bowel and also called the back passage. This part stores excrement before it is pushed out of the body. Bowel cancer is common in both the genders, but the risk increases as we age. The symptoms associated with colorectal cancer are pain in abdomen or back passage, bleeding from the rectum or blood in toilet, a change in normal bowel habit, even after you have already been to the toilet if you feel like going again. Weight loss is common in cancer patients. Tiredness and breathlessness caused by a lower than normal level of red blood cells, also called anemia. In some cancer cases, cancer can block the bowel. This is called a bowel obstruction. In case of that, the patient feels bloated, feels cramping pains in the abdomen, becomes constipated and unable to pass anything from the rectum. Another thing to note is blood in the toilet can be due to other reasons. If it came from the rectum, it can be due to other issues like hemorrhoids. If the blood is bright red, it is more probably from those swollen veins in the back passage. If the blood is of dark color, it will be from the colorectal area. Darker the color, further away from the bleeding is. In some cases, bleeding from the small bowel or the stomach ulcers can be another reason. There are several methods used to diagnose the colorectal cancer. It can start from physical examination in doctor's surgery to colonoscopy and CT scans of the large bowel. If the cancer is growing in the rectum, a GP can examine it in the surgery and refer for further tests. Colonoscopy is a procedure where a small camera is inserted into the back passage using a flexible tube and result can be seen on a monitor. A CT scanner takes pictures of the abdomen from all angles to see if the cancer is contained in the large bowel or it has spread to other parts of the body. Other than CT, Other tests like PET-CT, MRI, or ultrasound scan can be performed depending upon the location of the cancer. The treatment for bowel cancer is radiotherapy, chemotherapy, or it can be surgery. Target radiation is given to the affected area to treat cancer cells. The patient might be given chemotherapy drugs to kill cancer cells. To clear the obstruction in the bowel, either stent is used or surgery is performed. Sometimes a surgery is performed by making a hole in the colon and a bag is attached to the abdomen called stoma to collect the waste in the bag. After this surgery, the patient doesn't need to go to the toilet anymore. Stoma is attached temporarily to rest the colon and ends of the colon are joined back together. If a large part of the colon is removed and it is not possible to join the ends of the colon, in this case, a permanent stoma is attached. Bowel cancer is the fourth most common cancer and the second most common cause of cancer death in the UK. 1 in 15 UK males and 1 in 18 UK females will be diagnosed with bowel cancer in their lifetime. In the UK, 54% of bowel cancer cases are preventable. 13% of the cases are caused by eating processed meat, 11% due to being overweight, 6% due to alcohol drinking, 7% are caused by smoking, whereas 2% cases are caused by ionizing radiation, 5% due to little physical activity, and 28% are caused by eating too little fiber in the diet. Low risk and lower HDI countries are gradually moving towards high risk due to lifestyle changes, that is high intake of processed meat, sedentary lifestyle, smoking, alcohol consumption, and little physical activity. While consumption of whole grains, fiber, and dairy products appear to decrease risk, but it depends upon the individuals if they choose to eat healthy and balanced diet. Decline in colorectal cancer incidence in some high-incident countries is linked to making healthy lifestyle choices and taking part in the screening program for early detection of colorectal cancer. To ease the rising burden of early onset colorectal cancer, the American Cancer Society lowered the recommended age for screening initiation for individuals at average risk from 50 to 45 years in 2018. And in October 2020, the US Preventive Services Task Force concurred in a draft recommendation statement. Prevention is better than the cure. Research suggests that eating a healthy diet that includes fruit and vegetable can reduce risk of cancer and heart disease. There is also strong evidence that regular exercise can lower the risk of developing all types of cancer. If you want to know more about duration and recommended exercise type, please watch my video on exercise. The link is in the description. This concludes the 7th part of the cancer series. I recommend you to watch the rest of the episodes on this series, which covers the history of cancer, chemicals responsible in cancer development, and most common types of cancer globally. If you found this video informative, you can share with your family and friends and subscribe to this channel for more informative content. Thanks for watching.